Good day! I bet you already heard about remote patient monitoring. Were you satisfied with what you heard? Aren't you curious about the benefits it brings? Well, worry no more, for we are to discuss new technologies related to healthcare, and our PM is on our top list. We are Group 4, and this is our PM. Best at getting better.
Hello, good day. I am Jed Crystal Mariano from BSN 2A Group 4, and now I will explain or discuss the introduction of remote patient monitoring. The healthcare system, which is largely focused on providing the greatest caliber of medical services and advancing a person's overall well-being, has undergone a significant transformation of our modern technology. Next slide. Modern hospitals are starting to adopt technology-enabled equipment due to technical benefits and the aim to offer a higher standard of medical care. A computerized network system that monitors the heart rate, blood pressure, and other biological units in each hospital room and successfully archive the data is now standard equipment. And for the continuation of introduction, here's Miss Rosalie Mateo to discuss. Thank you.
Hello, good day. I'm Rosalie S. Mateo, and I will be discussing the continuation of introduction. So, remote patient monitoring, also known as remote physiologic monitoring, is one of the virtual healthcare services and delivery platforms in today's healthcare environment. Most people had never heard of RPM or remote patient monitoring, but this is changing as more professionals approve and prescribe the service to their patients. Remote patient monitoring was becoming more common before the COVID-19 health global crisis. When the outbreak hit, the usefulness of providing remote patient monitoring services to patients who were expected to limit travel and direct contact with others became even more apparent. Next one is RPM is a method of healthcare delivery in which patients' health is monitored utilizing technology outside of a traditional clinical setting, according to mHealth Intelligence 2022. Weigh scales, pulse oximeter, blood glucose meter, blood pressure monitors, and heart monitors and other specialized monitoring are all employed in RPM programs. Remote patient monitoring is a technology to enable monitoring of patients outside of a conventional settings, such as at home or in a remote area, which may increase access to care and decrease the healthcare delivery cost. Next is the history that will be discussed by Ms. Lopez. Thank you.
Good day, I am Crystal Ansel Lopez and I will discuss the history of the remote patient monitoring. So we all know that in 1800s, remote patient monitoring began when there is a physician who consulted over the phone. And in 1924, a cover radio news magazine discusses the use of radio for consultation. Then when the technological advancement rises, there is one physician that used it in 1948. And in 1959, physicians in Pennsylvania began transferring X-ray photographs over the phone lines. And in 1960, by confined television, psychiatric appointments are being delivered, and doctors began sending EKG readings over the phone in the late 1960s. Then it became the ideal in remote patient monitoring space. And also, Alan Shepard flew the spacecraft Freedom 7 in May 1961, became the first American in space. His doctors largely relied on his test trainings. So in 1967, also the doctors began broadcasting EKGs through telephones. In 1970, the Kaiser Foundation International and Lockheed Missiles in Space Company had a built remote patient monitoring system to deliver treatment on a Native American reservation in Arizona. And in 1980, sending X-ray photographs became a commonplace. It was common to them to send X-ray photographs through lines. And in 1990, the introduction of the internet altered the field, and the internet expansion has left traditional telemedicine in the dust. Telemedicine did not take off until internet infrastructure became accessible. And in 1998, in the Philippines, the growth in telemedicine began with the establishment of the National Telehealth Center, or the NTHC, of the National Telemedicine Service Project. That's all. Thank you.
Good day, I am Patricia Irish for CDG Mahabat, and today I will discuss the description of remote patient monitoring devices. Before 2020, most individuals had never heard of remote patient monitoring, or the RPM, but that is changing as more clinicians adopt the service and prescribe it to their patients. And according to the Center of Connected Health Policy, or the CCHP, RPM programs may also assist in keeping people healthy, enabling engaging and handicapped folks to live at home longer and prevent moving. Health data includes key indicators such as blood pressure, weight, heart rate, and blood sugar levels, which take place anywhere the patient is, eliminating the need for in-person visit to a clinic. According to a new consumer study association, roughly 2/3 of surveyed doctors firmly intended to use remote patient monitoring technology, such as continuous glucose or blood pressure monitor, to handle their clients' future health. According to the medical profession question, the main advantage of using to monitor health include better patient outcomes, increased compliance rates, and patient taking more responsibility for their health. The top three benefits for patients include comprehensive knowledge about personalized health, faster access to quality health care, and greater control of their well-being through the management of health data.
Hey, I am Leia Masana, and today I will discuss the four of the most prominent remote patient monitoring devices. First is blood pressure. A remote blood pressure monitor helps physicians monitor and manage constant visual hypertension. Remote monitoring helps reduce misleading blood pressure measurement through treatment visits caused by white coat hypertension. Next is weight monitor. Remote weight monitoring is often done with a scale. Regular monitoring can help physicians discover patterns and track progress while assisting patients in losing weight. Remote weight monitoring can assist in identifying rapid weight loss if it occurs suddenly, considering effects such as broken bones, a weakened immune system, dehydration, and weariness. Third is blood glucose monitor. Blood glucose monitoring is vital for diabetes client well-being. Practitioner can use data from a remote blood glucose monitoring devices to detect potentially harmful swing in glucose level and respond swiftly. The gathered data can guide medication, diet, and exercise recommendation. Last is spirometer. The spirometer measures the volume and flow of the air that a person breathes. It is used to diagnose lung problems and assess and monitor illness such as asthma and chronic obstructive pulmonary disease.
Thank you, Ms. Masana. Again, good day. I'm Mina Luis Socanya to continue with the discussion. RPM, merits and demerits, or in simple terms, its advantages and disadvantages. While the advantages of remote patient monitoring have been known for years, the 2020 COVID-19 pandemic has brought many of them to the forefront. As the healthcare sector continues to alter and evolve, remote patient monitoring promises to benefit both doctors and patients. There are 5 merits included in this discussion. First, reduce the possibility of disease transmission. According to the Healthcare Information and Management System Society Incorporated, remote patient monitoring is required for COVID-19 patients. To quote, "For patients who test positive for COVID-19, home-based surveillance for symptom escalation can assist limit the risk of transmission and also focus the timely provision of hospital-based therapy if necessary. Second, make available limited hospital resources. The COVID-19 pandemic has put enormous strain on hospitals in numerous countries throughout the world. With hospital staff and accessible beds in short supply, the ability to remotely monitor patients at home frees up scarce resources for most urgent situations. Third, obtaining better patient data more quickly. Remote patient monitoring using connected health devices provides healthcare providers with faster access to accurate patient data. Implantable devices, biometric sensors, pulse oximeters, blood pressure cuffs, glucometers, and other devices fall under this category. These gadgets and the data they offer, when integrated to remote patient monitoring platforms, can help speed diagnosis and permit quick treatment plan revisions. Fourth, better patient outcomes. Many studies have demonstrated that using remote patient monitoring technologies reduces the risk of rehospitalization and mortality in a variety of medical use cases, including implanted cardiac defibrillators. Last and fifth, cost-cutting measures. Reduce hospital readmissions, fewer in-person visits, and avoid readmission penalties under the Affordable Care Act or ACA are all clear cost-cutting measures for healthcare providers. As healthcare expenditures for patients and providers continue to climb, remote patient monitoring systems deliver a significant ROI in conjunction with improved patient outcomes. The Centers for Medicare and Medicaid Services, or CMS, recognizes these advantages and is working to make remote patient monitoring even more cost-effective. Moving on to its demerits, too expensive and connectivity. Despite the said benefits, some healthcare providers may believe that remote patient monitoring is simply too expensive for them to set up, let alone have their patients sign up for. However, this is not a cause for alarm because launching a pilot program focusing on patients who can assist lower healthcare expenditures is the most simple thing. For example, you can instruct RPM to monitor your patient's blood glucose levels, allowing you to lower the quantity of insulin they require. One prevalent misconception is that remote patient monitoring will not work without a broadband access. Because RPM candidates live in rural, isolated areas with few clinics, connection is an important factor to consider. However, RPM does not necessitate a large amount of data for all patients. According to mHealth Intelligence, you can sometimes perform fairly well with conventional Wi-Fi, which patients connect to with their smartphone or medical monitor devices. To reap the benefits of remote patient monitoring, a deployment approach that prioritizes security and scalability is required. Securing linked health devices should be a major priority since malicious telehealth assaults are on the rise. A partner who understands the complexities of connected health for remote patient monitoring can assist in simplifying the difficult deployment process. To continue with the discussion, Ms. Pangilinan.
Thank you, Ms. Ocanya. Good day. I am Angelo Panghilinan and I will be discussing the remote patient monitoring revolution. With the emergence of the COVID-19 pandemic, there is an increased demand for enhanced detection and health monitoring systems that could provide medical assistance at home. Remote patient monitoring gained popularity during the COVID-19 pandemic because it is an efficient method for monitoring patients at home. Prior to 2020, the majority of people had never heard of remote patient monitoring. But that is now changing as more doctors start using this technology and recommending it to their patients, especially after the lockdown was implemented.
Since patients are hesitant to visit hospitals due to concerns about infections and hospital overcapacity issues, remote patient monitoring technology became very popular and very useful because it can track and collect health data from patients and electronically transmit this information to healthcare providers. According to Precedence Research, the market size of remote patient monitoring is expected to grow by 5.1 billion by 2030. Therefore, we can assume that remote patient monitoring is the future of healthcare in 2030. Even once the global crisis has passed, the remote patient monitoring will play an essential role in reaching out to rural communities and avoiding the need for patients to come to clinics for routine consultations. Rural residents can also utilize these technologies to consult with medical doctors securely and safely. Just like what I have mentioned, even after this global crisis, remote patient monitoring will play an essential role in reaching rural areas where distance and travel time between patients and healthcare providers is a significant barrier. Remote patient monitoring bridges the barrier of access by providing care to patients even when they are at home. This benefits the rural patients since they are no longer required to travel long distance to access specialty care. A common misperception about RPM or remote patient monitoring is that it won't work without a broadband connection. However, RPM does not require a huge amount of data for all patients. Sometimes, you can do quite well with ordinary Wi-Fi as noted by mHealth Intelligence. And to further discuss this topic, Ms. Padua will proceed.
Good day. To continue the discussion, I am your reporter, Micaela Padua. Even if the global pandemic has ended, the RPM will continue to be utilized. I believe that every healthcare professional has seen the benefits it gave during the pandemic where no one could go out and only technologies played out. The use of RPM devices continues to improve and develop, thus being used widely as the benefits it has were tried by the public. However, RPM devices still got rooms to improve, and with the aim to aid in health, RPM devices will increase flexibility, consistency, and convenience, especially for patients, clinicians, wellness, and treatment. And here are the references used for the study. Thank you for listening, and once again, we are Group 4, and this is RPM, Best at Getting Better.